and those are the patients that really are excellent candidates for liposuction, because the fatty tissue can be, again, broken up with a special instrument and then sucked away, and the heat that's generated by the ultrasonic device, or in some cases a laser device, stimulates the skin to shrink. So consequently, the fatty tissue is removed, and then the patient is placed in a special garment, basically a compressive garment, like a long-line girdle or that sort of thing, depending on the area you're working in. There are some that go from the knee to the breast area, if you're removing fatty tissue from all of the areas in between. And we have those patients wear those for prolonged periods of time, pretty much 24/7, other than when they're showering. And what happens is when you remove the fatty tissue with liposuction, swelling replaces it initially. So the skin doesn't shrink right away, but as the swelling goes down, the skin shrinks. And we want to guide the skin to shrink evenly and smoothly and with a good contour. So we use these compressive garments. And again, they can be used in any area of the body.
Well, let's go back to the liposuction. Say for someone looking to address the saddlebags, as we call them, how long is this procedure generally, typically? I mean, does it matter on how much fat someone has, or, of course, their body size and body type?
Well, it really is a question of an area where a person cannot lose the weight. Liposuction is not meant to be a cure for overeating or being, too heavy, because you can only remove a certain amount without it becoming a sort of a risky situation. But if used appropriately, you can remove a lot of fatty tissue in one sitting from a patient. You can maybe remove up to 5, 6, 7 pounds of fatty tissue.
Wow.
And that is a lot when you consider you're just removing the fatty tissue. So from the thighs, the abdomen, sometimes what many people call the love handle areas, what we like to call the upper lateral waist areas and that sort of thing. That's an area that's common in men. There are some areas that are more common in women, the outer thighs,
Sure.
maybe the lower part of the abdomen. In men, sometimes it's the love handle areas or the lateral waist areas. Sometimes it's the pectoral regions. We see men who have either what's called gynecomastia, some male pattern breast tissue surrounded by fatty tissue, and that can be removed with the special ultrasonic device. So there are a number of different things, but there's a limit as to how much. If a patient has a lot of fatty tissue that needs to be removed, you sometimes have to break it up into 2 sessions to give the body the chance to recuperate and not remove too much tissue at one time, because that can weaken an individual and can be risky.
Sure, and all makes sense. Dr. Romero, you also offer, of course, different types of breast surgical procedures.
Right. We see patients of all ages for different breast procedures. Younger patients in 20s and or so, we see frequently for breast augmentation or breast enlargement. Girls who have breast tissue but don't quite fill out the clothing the way they would like to, and that sort of thing. Breast augmentation is a good remedy for, or produces a good result in that aspect. And within reason, we can give the type of size and shape of the breast that a patient wants in an outpatient procedure that takes about an hour and a half, and then an hour or so in a recovery room. And somewhat older patients in their late 30s or early 40s, we see frequently patients who have had 2 or 3 children, at what time had supple, well-developed breasts, but then had some atrophy of the tissue and are left with the skin, which does not shrink up, but the breast tissue, which has shrunk up. So many times they can benefit from a combination of a breast lift procedure, where we lift the nipple area and the breast itself back to where it should be, because it's been stretched downward with the weight of pregnancy and nursing. And then we can, after putting it in the appropriate position, we can fill it again with a breast implant placed behind the muscle layer, so that that's well disguised, not to show that the person has a breast implant. It also allows the person to have mammograms done in the future without any obstruction of the mammograms and that sort of thing. And so that's a procedure we do very commonly. In addition, we do a breast reduction. In fact, our happiest patients tend to be patients who have had huge breasts all their lives. We hear quite frequently, patients will come in their 40s or so and say, I've done everything for my family all along, and I'm tired of carrying around this huge amount of weight. I've got these strap marks on my shoulders, and my neck is constantly bothering me. My posture is not good because I'm carrying this weight around. And they undergo a breast reduction, and many times their comments after will be, I just wish I'd have done this sooner, you know. And they're really some of our happiest patients. And obviously, patients who undergo breast reconstruction after having a mastectomy from breast cancer and undergoing chemotherapy, and then being finished with the treatment and being cured or being in remission, become candidates for reconstructive techniques where the breast can be rebuilt.
Okay, we're going to take a short break, but we're going to come back and we're going to talk more with Dr. Russell C. Romero. You're watching Healthwise.
Opelousas General Health System, this area's premier regional healthcare facility, now offers 3 convenient locations.
Wonderful staff here, very knowledgeable. I continue to improve.
A wide range of specialties are available without having to travel to Lafayette. Big city medicine right here at home. Opelousas General Health System.
Peace of mind is what we want for our family and belongings. To know if the unthinkable may occur, Safeguard will be there. Dupre, Carrier, and Godshaw has been a partner in the Lafayette community, protecting families and working at matching the right policy to each person. DCG offers a large variety of coverage options from the top insurance providers: commercial, auto, home, health, life, and financial products. DCG in Lafayette and other convenient locations. DCG Insurance is the team that's here for you.
The unique gift shop inside of Carl's Thrifty Way Pharmacy offers something for every occasion. A large selection of jewelry, purses, Lamborghini lamps and oils, Tyler candles, and freshly ground gourmet coffee are just a few of the selections you can choose at Carl's Gift Shop. If decorating your home is on your mind, then Carl's Gift Shop is the place. An in-house interior decorator and florist is available to help you make your home a showplace. Gift wrapping is free, and the friendly staff at Carl's Gift Shop in Opelousas will always be happy to assist you.
Welcome back to Healthwise here on RTV, KDCG, and in the studio this evening we've been speaking with Dr. Russell Romero, Plastic Surgery Associates, and your office on College in Lafayette.
Correct.
Well, you've been telling us about the body contouring procedures, the breast procedures, and but there's one of the important components to your work is working and helping children, doing reconstructive surgery for children, and that's
Correct.
kind of, you've got a really really unique background in that, Dr. Romero.
Well, I originally went to dental school and was a dentist, and began training as an oral surgeon, and in doing that I became exposed to plastic surgery, and particularly plastic surgery in children. And so that, for a lot of reasons, is the love of my life. You know, you change a life when you do something for a child who is born with a congenital deformity. And we take care of a lot of children who are born with cleft lip, cleft palate, those sort of things. maybe large birth moles or birthmarks and that are at risk of developing into cancer at a later age. So there's a whole spectrum of things we do for children. The state of Louisiana has a very good program which is called the Children's Special Health Services, and it helps provide care for families with children who otherwise would not have resources to obtain it. And physicians like myself volunteer at no cost to take care of patients in those capacities. And the hospitals in the Acadiana area allow us to do the procedures in their hospital with special contracts and arrangements with the state. So it's one of the things that Louisiana is way up front and ahead of a lot of places by doing. And for me, it's very special to see these children grow up. I've had several now that have graduated from high school and college that I've taken care of from babies. And in fact, we've expanded the work we do, and I have a group of friends who are physicians, dentists, ophthalmologists, and we go to Mexico and do mission work there, doing the same types of things we do here. People often ask me, well, why is it more common in Mexico than it is in, but it's not more common in other countries so much, as here we have access to the children, they have access to care. Nowadays, I've actually seen parents come to me with an ultrasound that the mother has had, and it shows that the child has a cleft lip or a cleft palate. And so we know ahead of time we can comfort them and show them pictures of other patients we've taken care of, and kind of give them some relief that we can make their child right and have a normal life in the future, and that's something special.
I can't imagine how, your team of physicians, when you travel to Mexico or do these surgeries, and you, as you described it, just a remarkable feeling that would come over you and helping and being so instrumental.
Right. The people are obviously very thankful for what we do, but we're actually more rewarded than they are when you see, and it gives you appreciation for how much we have here, how good our lives are, the access that we have to things. And not to be political, but when I hear everything going on right now about how we need to change our health system, and then I go to Mexico and see, and other third world countries, and see how tough people have it, we really have a good situation here.
Well, that's a good note to end this program on. And thank you so much for being with us, Dr. Russell C. Romero, Plastic Surgery Associates. And we'll see you next time on Healthwise. Thanks for tuning in.
Healthwise is brought to you in part by Opelousas General Health System.
Roy Motors in Opelousas has been your full-service dealership for over 70 years. From new cars and trucks to pre-owned certified used vehicles, we always have a great selection. From oil changes to AC repair, our service department handles all of them. From painting to framework, our body shop can do it all. And a parts department that can handle all GM parts and accessories no matter what make or model. So no matter what your automobile needs may be, come see us today at Roy Motors in Opelousas. There is a reason.
Banking has gone through big changes in the last few years, and even though St. Landry Bank has been at the forefront of integrating improvements into your banking experience, we have not forgotten the importance of good old-fashioned service with a handshake and a smile. Along with internet banking, St. Landry Bank offers a wide range of personal and business services. And with banking roots that go back to the 1890s, it's no wonder why St. Landry Bank is still the home team.
St. Landry Bank, the home team, how may we help you?
And you'll get the multi-card discount and the safe driver discount.
And you'll save big on the paid in full discount. And the anti-theft discount.
Wow.
And the homeowner's discount. And the paperless discount. The multi-freckle discount.
I'm just making sure you're listening.
And not to mention the multi-policy discount.
Would you like one great big bag or two still pretty big bags?
Call ABC at 877-611-0195 to get all the hard-earned discounts you deserve.
Honesty. Pass it on.